This is a presentation on vascular Ehlers-Danlos syndrome, or vascular EDS for short, which is a specific subtype of Ehlers-Danlos syndrome. This presentation was made in collaboration by David, Jenny, Maxine, Sarah, and Sydney. This document is available for your individual use. However, further distribution may infringe copyright. This presentation will be split up into 6 different sections. First, we'll talk about the affected gene in vascular EDS, and then we'll move on to the mode of inheritance, followed by the clinical presentation. Next, we'll talk about the frequency, and then the diagnostic testing that is available for vascular EDS. And then we'll end on the available treatment for vascular EDS. So first, we'll talk about the affected gene. The affected gene in vascular EDS is typically COL3A1. The function of this gene is to encode for the collagen alpha-1 chain, which is required for the formation of collagen, specifically type 3 collagen. This type of collagen serves an important role in maintaining the structure of blood vessels, skins, and hollow organs. This protein is expressed in several organs, as we will see in the next slide, with the expression being the greatest in gallbladder, placenta, and urinary bladder. This is an image from OMIM showing the different types of tissues in which COL3A1 is expressed in. This gene, as shown, is expressed in many tissues. However, as previously mentioned, expression is greatest in gallbladder, placenta, and urinary bladder. The most common variant associated with vascular EDS are glycine substitutions within the helical region of the protein. The image on the right was pulled from one study where variants in the gene COL3A1 was examined in participants with known vascular EDS and where none of the participants were related to each other. As you can see, almost half of the variants observed in the study were due to a glycine substitution. These pathogenic glycine substitutions typically will alter the structure of the protein produced, which will lead to a reduction in the secretion of the collagen protein. Next, we'll talk about the mode of inheritance. The mode of inheritance for Ehlers-Danlos syndrome can be autosomal dominant or recessive, but it depends on the disease classification. Since this presentation is on vascular EDS, we'll just focus on vascular EDS. The mode of inheritance in vascular EDS for the most common pathogenic variant in COL3A1 is almost always autosomal dominant. For vascular EDS, 50% of individuals will have an affected parent, but the other 50% of individuals will have a de novo pathogenic variant, which means that the variant is found for the first time and is not seen in either of the parents. Now we'll move on to the clinical presentation. While all the clinical presentation may seem unrelated at first, due to the wide distribution of collagen in the body, individuals with vascular EDS will present with various clinical presentation. Thus, pathogenic variants in the COL3A1 gene associated with vascular EDS can be described as pleiotropic. The most significant clinical presentations are related to the cardiovascular system. Due to collagen abnormalities, they will have very fragile blood vessels, which will put them at risk of fatal vascular events. Some individuals may experience the vascular event sooner than others. However, everyone with vascular EDS will experience some sort of vascular event with varying degrees of severity. Next, we'll talk about the frequency of vascular EDS. A 2014 study of survival rate for vascular EDS gave an estimate of 1 in 25,000 people who are affected by this disease. In a separate 2000 study of index patients and their families who had vascular EDS, they presented data on the deaths of 131 of the subjects, 26 of whom were primary patients and 105 were relatives. From the results, they concluded that the median survival rate was 48 years for their entire cohort. Deaths ranged from 6 to 73 years of age, with the most major cause of death being arterial rupture, which accounted for 103 of those deaths. Another cause of death was organ rupture and also bowel rupture, causing sepsis. We have included the Table 2 of the study to show the breakdown of the causes of death found in their patients and patients' relatives. Since major complications are known to take place for people with vascular EDS, 25% reported having one by the age of 20, and 80% reported having one by the age of 40. Women with vascular EDS can have pregnancy-related complications such as uterine rupture, placental rupture, and preterm delivery. These complications make pregnancy a higher risk for women with vascular EDS. In a retrospective study cohort where they focused only on women with vascular EDS, they found that 5.3% of women with a protein-altering mutation in the COL3A1 gene had a pregnancy-related death, while none of the women with a heterozygous null mutation did. From a separate vascular EDS study, there were 3 stillbirths and 10 spontaneous abortions out of 183 pregnancies. Next, we'll talk about the diagnostic testing available for vascular EDS. Before establishing diagnosis of vascular EDS, individuals should be suspected with any one of the following major diagnostic criteria: arterial aneurysm, dissection, or rupture, intestinal rupture, uterine rupture during pregnancy, or a family history of vascular EDS. Both molecular gene testing and biochemical analysis can be used to establish diagnosis. For molecular gene testing, we can detect single or multi-gene for the identification of a heterozygous pathogenic variant in COL3A1. And when the phenotype is indistinguishable from many other connective tissues, we can utilize comprehensive genome testing. Biochemical analysis is analysis of type 3 procollagen synthesized by cultured fibroblast cells. This is to identify abnormalities in the synthesis and mobility of type 3 collagen chains. This type of testing is used when vascular EDS is suspected, but molecular genetic testing could not identify a COL3A1 pathogenic variant. Finally, we'll talk about treatment. Currently, there are no care available for vascular EDS. Individuals with vascular EDS get medical treatment for their fragile blood vessels. Example of treatment would include antihypertensive medication to manage their blood pressure and surgical replacement for their high-risk blood vessels. One of the emerging treatment is celiprolol. It is a cardioselective beta blocker that decreases the pressure on collagen fibers. This reduces the likelihood of fatal vascular events such as arterial rupture and aneurysms. However, celiprolol does not eliminate the occurrence of fatal vascular events. Thus, individuals with vascular EDS still require close monitoring. There are several limitations to this presentation. The celiprolol study that we just talked about had a very small sample size, and major vascular events may still occur even with the medication. In addition, variants in COL3A1 involved in vascular EDS is heterogeneous in nature, and glycine substitutions may not be the only pathogenic variant associated with vascular EDS. Furthermore, family history may not be relevant, as 50% of cases are due to a de novo variant, as we discussed. This disease is so rare that it is difficult to obtain a large sample size for accurate extrapolations for populational frequencies as well. And here are the references that we use for our presentation. Thank you for making it to the end of this presentation. Our group wanted to give you a collective thanks for making it this far.
Thank you for listening.